Hi, I'm Bin Han from Qilu College of Medicine, and I'd like to welcome you to this video tab course on opportunistic fungal pathogens. The fungal pathogens can cause fungal diseases, which can affect almost anyone. Learning about them can help us and our doctor recognize the symptoms of a fungal diseases early and may help prevent serious complications. Fungal diseases are often caused by fungi that are common in the environment. Most fungi are not dangerous, but some types can be harmful to health. Mild fungal skin diseases can look like a rash and are very common. Fungal diseases in lungs are often similar to other illnesses such as the flu or tuberculosis. Some fungal diseases like fungal meningitis and bloodstream infections are less common than skin and lung infections, but can be deadly. Fungi are everywhere in our life, outdoors, indoors, and on people's skin and inside of the body. Sometimes they are too small to see with the naked eye. There are millions of fungal species, but only a few hundred of them can make people sick. Molds, yeasts, and mushrooms are all types of fungi. Fungi can cause many different types of illnesses, including eczema or allergies, rashes or infections on the skin and nails, lung infections with symptoms similar to flu or tuberculosis, bloodstream infections, and meningitis. Weakened immune systems cannot fight off infections as well due to conditions such as HIV, cancer, organ transplant, or certain medications. Today, we are gonna introduce three most common opportunistic fungi: Aspergillus, Candida albicans, and Cryptococcus neuriformis. Aspergillosis is a disease caused by Aspergillus, a common mold that lives indoors and outdoors. Most people breathe in Aspergillus spores every day without getting sick. However, people with weakened immune systems or lung diseases are at a high risk of developing health problems due to Aspergillus. There are different types of aspergillosis. Some types are mild, but some of them are very serious. There are two main types of aspergillosis in immune deficient people. The first one is invasive aspergillosis. It occurs when Aspergillus cause a serious infection, and usually affects people who have weakened immune systems, such as people who have had an organ transplant or a stem cell transplant, are getting chemotherapy for cancer, or are taking high doses of corticosteroid. Invasive aspergillosis most commonly affects the lungs, but it can also spread to other parts of the body. The second one is cutaneous aspergillosis. It occurs when Aspergillus enters the body through a break in the skin, for example, after surgery or a burn wound, and cause infections, usually in people who have weakened immune systems. Cutaneous aspergillosis can also occur if invasive aspergillosis spreads to the skin from somewhere else in the body, such as the lungs. There are also some other types of aspergillosis, such as allergic bronchopulmonary aspergillosis, allergic Aspergillus sinusitis, azo-resistant Aspergillus fumigatus, Aspergilloma, and chronic pulmonary aspergillosis. The invasive aspergillosis usually occurs in people who are already sick from other medical conditions, so it can be difficult to know which symptoms are related to an Aspergillus infection. However, the symptoms of invasive aspergillosis in the lungs, including fever, chest pain, cough, coughing up blood, shortness of breath, and other symptoms, can develop if the infection spreads from the lungs to other parts of the body. During the cellular invasion, once Canidia of Aspergillus swell, beta-glucan in the candidal cell wall is recognized by detectin-1, activating PLD1 and PLD2 and promoting actin polymerization. Another as yet uncharacterized signal results in the phosphorylation of cofidin-1, causing it to release actin. Candida are then internalized through actin and microtubule polymerization and phagocytosis. Upon internalization, they are trafficked through the endosomal system, where they are degraded and cleared from the host, or alternatively, small numbers may persist, generate, and escape. It's difficult to avoid breathing in aspergillosis spores because the fungus is common in the environment. For people who have weakened immune systems, there may be some ways to lower the chances of developing a severe aspergillus infection. The first is to protect yourself from the environment. Try to avoid areas with a lot of dust, like contraction or excavation sites. Avoid activities that involve close contact to soil or dust, such as yard work or gardening. To reduce the chances of developing a skin infection, clean skin injuries well with soap and water, especially if they have been exposed to soil or dust. The second is using antifungal medication. Voriconazole is currently the drug of choice because it causes fewer side effects and appears to be more effective than other medications. Amphotericin B or itraconazole are also effective in treating infections. Caspofungin is sometimes used in cases where the infection is resistant to the other antifungals. And the third way is testing for early infection. Some high-risk patients may benefit from blood tests to detect invasive aspergillosis. In this part of video tab course, we generally introduce the opportunistic fungal diseases and the symptoms, cellular invasion, and prevention of aspergillosis. Next part, we will introduce you another opportunistic fungus called Candida. Thank you.